Good morning, and thank you, Dr. Berman, thank you very, very much. I also want to thank the Dean of the Law School, Dr. Haddon, and for having us here. We're deeply honored to be here. I also want to make sure that everybody is well aware that while Senator Cardin and I are graduates of the law school, our distinguished colleague and Senator Mikulski, is a graduate of the University of Maryland School of Social Work. So we feel right at home here. Today we have assembled at this forum to discuss the state of children's dental health 5 years after the preventable death of Deamonte Driver. His tragic death at the age of 12 opened our eyes to the crisis in dental care for low-income children. We're here to discuss the improvements we made in the last 5 years and to talk frankly about what remains to be done. I'm very pleased to be joined today by my colleagues, Senator Mikulski and Senator Cardin, who both share my commitment to seeing that another family never suffers the same tragic loss. And again, I want to thank Dr. Perman for his warm welcome to us, and we're very, very pleased to be here to carry school today. I'm also always very pleased to return to my alma mater, and I'm extremely grateful for all of the hard work of your staff to ensure the success of this program. I'm also pleased to be joined by federal, state, nonprofit, and community partners who are here today to discuss how they have helped turn dental care from a privilege into a right. Thank them for giving a voice to children who might not otherwise have one. I thank them for recognizing the value of this investment in their future. And I thank them for honoring Deamonte's legacy. Jeremiah 15:9 reads, "Her sun has gone down while it is still day." Deamonte's sun set too soon. But from that ending has come a new beginning and a new mission. I'm inspired by Deamonte's mother, Elise Driver, who has now completed her basic training in the dental assistance program at Prince George's Community College. With the help of the United Healthcare and the Southern Maryland Dental Association, she is continuing her education in dental radiographic anatomy and working in the office of Dr. Belinda Carver Taylor of Capitol Heights. She is a powerful example of the light that has come from Deamonte's death, and hers is just one instance of the positive outcomes achieved during the last 5 years. At the federal level, we have secured guaranteed dental benefit for children enrolled in the Children's Health Insurance Program. We've also secured gains through the Affordable Care Act, which requires a pediatric dentistry benefit for every insurance package offered through the Health Insurance Exchange. It also includes investments in oral health infrastructure and the oral health workforce that will help to support a sustainable dental health system. At the state level, I am proud that Maryland has been recognized for leading the way on children's oral health. With the help of the Maryland Dental Action Coalition, the state has made a commitment to increasing access to quality services for our children. On the provider side, the state has increased its Medicaid dental reimbursement to 70% of median retail fees, one of the highest reimbursement rates in the entire country. This has contributed to a nearly 85% increase over the past 2 years in the number of dentists in Maryland who see Medicaid patients. Maryland is proof positive that investment in dental health produces results. The percentage of Medicaid enrollees in the state who have accessed dental health services in the last year is now 64%, 18 points higher than just 2 years ago. The investments we make now in our children's dental health will last a lifetime. However, our efforts must start with a simple message to families about the importance of oral health, the power of prevention, and the importance of regular screenings. Fear remains a powerful impediment that limits access to care. But we can overcome that barrier with improved oral health literacy in our communities and in our schools. You'll hear today about the difference our endeavors have already made in the ongoing effort to reach the underserved, but there is more to be done. We must protect the progress we've made if we want to prevent another tragedy, and we must commit ourselves to closing the gaps that still exist. I hope you'll join me in renewing our commitment so that 5 years from now, we can mark another anniversary with the news of continued gains.